somewhere in your house, maybe in the same cabinet as the aspirin, there might already be a bottle of it. A pill.
Cheap. Boring.
Prescribed for diabetes for over 60 years. And for the last decade, some of the top aging researchers in the world have wanted to test whether it also slows aging itself. They still haven't been able to. Not because the science fails. This is Bonarixe. Here's what this video is going to answer. How does one of the most promising anti-aging candidates get stuck for 10 years without a single experiment proving it doesn't work? Let's find out. The drug is called Metformin. If you know it at all, you probably know it as an ordinary type 2 diabetes medication. It's been prescribed safely for more than 60 years. It costs about $4 a month as a generic. Nothing about it sounds exciting. That's actually the point. Here's where it gets strange. First worms, then mice. Every time scientists test it, the animals seem to stay biologically younger for longer. Then researchers noticed something odd. In real people, a large study looked at diabetics taking this drug and compared them to people who didn't even have diabetes. The diabetics, people with the disease, lived just as long, in some analysis even a little longer. That result gets misquoted constantly, so let's be precise. It's a correlation, not proof the drug itself caused the difference. People who get this prescription early and stay on it may simply be healthier or better monitored to begin with. But it was strange enough, and it kept showing up, that it caught serious scientific attention. Then in 2024, the evidence got harder to wave away. Researchers gave it to male monkeys, animals far closer to human biology than any worm or mouse, and measured how fast their bodies were aging, using the same kind of biological aging clocks used across modern longevity research. The treated monkeys aged more slowly across multiple organs. This was by far the closest evidence yet that this ordinary diabetes pill might do something no cheap, generic, already approved drug has ever been shown to do in an animal this close to us. So naturally, the next step is obvious. Run the definitive human trial. The trial already has a name, TAME. We'll just call it the trial from here. Here's what makes it historic, even before a single result exists. Back in 2015, regulators agreed to something that had never been done before, treating aging itself as a thing being measured, instead of just one disease at a time. If this succeeds, it doesn't just tell us about one pill. Instead of waiting until someone develops cancer or dementia, doctors could eventually target the process that raises the risk of both before either one shows up. Everyone assumed this would finally settle the question. It didn't. There's just one problem. As of right now, this trial still hasn't launched at full scale. Why would one of the safest, most promising anti-aging candidates we've ever found still be sitting on a shelf? Here's where most coverage stops, because the real answer isn't biological, it's financial. Metformin has been off patent for decades. Any company can manufacture it, nobody owns it. Which means running a massive multi-year clinical trial, one large enough to prove it slows aging in humans, costs enormous amounts of money, and whoever pays for it can't recoup that cost by selling the drug afterwards, because everyone can already buy it for almost nothing. Imagine discovering something that could change medicine and realizing nobody has a real reason to pay to find out if it's true. It isn't biology, it's money. That's a strange kind of failure. Not too risky, not too weak a result, too cheap. And this reframes something bigger than just one pill. a lot of the exciting aging research out there, new detection methods, new lab discoveries, new mechanisms eventually runs into the same wall. Does it survive the jump from a lab result to an actual treatment a person can use? Metformin already cleared that wall decades ago, for a completely different reason. It's one of the most studied, safest drugs on the planet, taken by tens of millions of people. The barrier here was never proving it's safe. It's proving definitely that it slows aging, and nobody has been willing to pay for that proof. That's a different kind of broken filter than usual. Not biology failing, incentives failing. And one more thing worth being honest about, metformin isn't risk-free or universally beneficial. It can cause real digestive side effects, can affect vitamin B12 levels over time, and recent research has even suggested it may balance some of the cardiovascular benefits people get from exercise. This video is not medical advice, and metformin is a prescription drug for a reason. Nothing here is a suggestion to take it off-label without a doctor's involvement. The evidence is genuinely promising. It is not yet proof. Maybe the biggest obstacle to living longer isn't discovering new medicine. Maybe it's proving what we already have. If metformin really does slow aging, who should actually pay to prove it? Governments, charities, drug companies who won't profit from it? Or is the honest answer that nobody's actually responsible? And that's exactly the problem. Tell me where you land in the comments. This is what this channel does every week. Take a claim you've probably seen in headline and show you exactly where it actually stands. Not hyped up, not dismissed, just a real picture. If that's useful to you, this is a channel for more of it. Next week, we're going somewhere stranger. The researchers who think the real key to slowing aging isn't your drug at all. It's a signal your own body is already sending and mostly ignoring. See you there.